World Health Organization has warned that Africa isn't ready for a third wave of COVID-19 infections. The organization says hospitals and clinics don't have the capacity to cope. At least 5 million infections have been recorded on the continent, with 130,000 deaths. Tiano Balde from the WHO in Eastern and Southern Africa joins us for more. Very good evening to you. Thank you for joining us. Tell us about your concerns when it comes to Africa and, in particular, South Africa.
Thank you so much. Thanks for the opportunity. Yes, the WHO Regional Office of Africa has been monitoring the situation in different countries, including South Africa and the Southern Africa sub-region. And definitely after a kind of 3 weeks of consecutive decline of the number of cases, we are now seeing really an upsurge, an upward trend of COVID-19 cases in our region here. And the majority, most of those cases are really coming from the southern part of the continent, driven so by South Africa and by some of the neighboring countries. And in terms of response capacities, we know that there are some limitations, but at the meantime also some of the efforts have been conducted, for addressing those limitations. And the vaccination is going to be rolled out in different countries, and this is what is happening currently. But definitely in terms of clinical case management capacities, we have some limitation. Many of these countries don't have all of the required number of health professionals, but also the materials and equipments, for handling most severe cases. But most of these countries also are trying really to get organized with the support of the World Health Organization, but also with the other partners, for really facing this battle, which is upcoming.
Okay, with that in mind, what are your expectations for the continent, and particularly Southern Africa, as the third wave hits?
Yes, we are seeing this increasing number of cases, and we do hope that, as you rightly mentioned before my intervention here, to encourage the people and the communities to get the vaccine as much as possible. Also to adopt these public health and social measures, barriers. And at the meantime, also reorganizing the healthcare system, by providing all of the necessary materials and equipments, and also having people who can treat the patients, whenever they arrived. Those are really the key elements, for really being ready. And we know that this will not be easy. However, we are really encouraging both member state organization of the World Health Organization, but also communities, really to go through these main directives, to allow us really to pass through this, the upcoming third wave.
Okay, and do we know enough about the variants out there? What can be done to tackle that?
Yes, it's unfortunately difficult currently to stop really the spreading of these variants. And as you know, the WHO has recently renamed some of these variants, and in some of the countries we are seeing really most of these variants, the beta variants and also the delta variants. The beta variants is the one which were firstly appeared in South Africa, but also we are seeing more and more in countries like Uganda, the delta variants, the one which has been discovered in India. But definitely, as I was saying again, with the effort on the vaccination, and also by putting more measures as some of the governments have been doing, by adopting these restriction measures, we do hope that at least the situation will not get out of hand.
How do you stop it from getting out of hand? Treatment is the last line of defense. You're seeing in so many countries that people don't even bother to put on masks. There's no social distancing.
Yes. Yes, absolutely. I think the education, the engagement of the people, we know that this has been a long battle, for 1 year and a half, now battle. And we do understand that people are getting tired, but again, we really need to make all of the efforts currently for adopting some of these measures, and to encourage people to go and to get the vaccine as much as possible. Today, we have some countries where the level of uptake of the vaccine is a little bit low. In some others, we have seen also a good uptake of the vaccine. So really we encourage people, community members, to go and to get vaccinated. And at the meantime also taking and adopting all of these public health and social measures that we've been promoting, and that also government has been promoting for the time being.
Are you seeing enough of a step up to handing out vaccines, to making them more acceptable by countries who do have them, who do have the money?
Yes, I mean, this is not an easy process. It's really a kind of complex process, both from the procurement of the vaccine to the distribution in the countries. We have seen, I mean, some of the challenges, for getting a good quantity of vaccines. Some of the vaccine has arrived in some countries. All of this vaccine has been used. A second, shipment of the vaccine are coming. But at the meantime, also, we have some other countries where some of the vaccine has not been really used. So a reorganization of these vaccine distribution is really something which is important, and also taking into consideration all of the elements which can really, mitigate this vaccine hesitancy, to encourage people to go and to get the vaccination. We have seen that this is really something which can really help us, getting out of this situation. The vaccination is really one of the measure, which has made his proof both for the COVID-19 but also for other diseases, cholera, Ebola, and many other type of diseases.
The more people vaccinated, the better for all of us. Tierno Balde, let's leave it there. Thank you very much from the WHO.